It's obviously a very, very delicate issue in any family, especially with underage young people. Your thoughts on this? Is this crossing a line?
Well, you know, it's really a public health issue, teen pregnancy. And though over the last 20 years it has decreased significantly, there's still over 300,000 teens that get pregnant. Over 40% are sexually active, so it has to be discussed. And we definitely think it's appropriate at least to talk about it. I'm not sure that just handing out the prescription just before they're even sexually active, some of them look at us like, what? I'm not even thinking about it. So I think it's how you talk to them and what you find out during your conversation, especially if you know them and have a rapport with them. So it's something that, you know, we always have the parents leave the room and we always talk about it, and we want to make sure they feel comfortable. Not all of them will, but I think it's good that they know there is something available, at least, because I think a lot of people don't know. But I want to clarify what it is also, because it is not the RU486. It is not the abortion pill. Right. A lot of people think that's what the morning after pill is, and it's not. So if it's taken within 72 hours, it prevents conception, it blocks ovulation. So it works that way so that they don't conceive. But we also don't want them to use this as a primary birth control method as well.
And doctor, do you feel an obligation to discuss this with the parents?
We don't always talk about it with the parents.
No.
We usually don't talk about it with the parents unless they, you know, I do have teenagers who are very open and they want to talk about it, or they're already on the pill because they talked about it and their mom said, I'm taking you to the gynecologist. So some of them have a really open relationship, and I think it's a really good thing. I think they need to talk about it and not be afraid, but not every family is comfortable discussing it. So at least if they can talk about it confidentially with us, I think that that's very important. They have somewhere to go.
So in effect, you'd be creating a safe haven where they can go and get expert advice and not feel difficulty like they might with a parent.
Right.
Okay, let's talk about that dad again that we saw the video on earlier. I mean, he's certainly not going to get Dad of the Year. No. It really is very upsetting.
It's so inappropriate. It feels, you know, when you look at it, I think other people feel the same way. It looks like he's prostituting his daughter. It's so wrong that anyone would ever do such a thing with their child. I mean, I know she's 20, but still. Not okay.
Picture tells a lot.
Not okay.
Getting to the holidays right now, and we're talking about safety for young kids. Toddlers, particularly, could find themselves in a dangerous situation. What are some just good tips you can give to parents?
Right. I think the things that are